While hospitals around the country are prioritizing COVID-19 patients, what's being done to ensure the safety and wellness of other non-COVID patients who still need intensive medical care? CBS 46's Carolyn Ryan speaks with one woman who says the Atlanta VA is putting the need of coronavirus patients ahead of her elderly grandfather's needs.
To the rest of us, 99-year-old World War II veteran Edward Farish is an American hero. To Sandy Farish,
what does that mean to you?
He's simply Grandpa.
He's just been there for me for my entire life.
So when she received a phone call from a social worker a couple of weeks ago telling her the Atlanta VA was going to relocate him to another facility, potentially out of state, to make room for COVID-19 patients, she was shocked and upset.
I told them they couldn't do it. There was no way that he could be away from his family that far.
Her grandfather is under 24-hour care at the VA hospital.
He is in hospice, and so he has less than 6 months to live.
Desperate for help, Farish turned to Senator Kelly Loeffler, who sits on the Veterans Affairs Committee in Washington. The senator tells me she reached out to the VA directly
to make sure that they understood his situation and that more care hours were merited. And so I first wanted to advocate for that, but to make sure that if he was moved, it was to a place where it was convenient to his family and that it would be right for his situation.
But Mr. Farish isn't the only elderly veteran at risk of relocation. CBS 46 obtained this letter sent to families of 34 residents at the VA's Community Living Center, notifying them their loved ones would be relocated as well. The VA tells CBS 46 those seniors were relocated to other facilities less impacted by COVID-19 for their safety and well-being, and that the additional space will allow its facility to prepare should it receive a surge of COVID cases. So far, it appears Mr. Farish is the only one identified that hasn't been relocated yet. His family is hoping it stays that way.
He deserves his dignity, and he deserves to be taken care of.
And currently there are 13 veterans with COVID-19 being treated at the Atlanta VA. 76 others are being treated as outpatients. Now, as part of that $2 trillion federal relief package, hospitals are receiving funds for treating COVID patients. Now, just how much the Atlanta VA is receiving for each COVID patient it treats, well, neither the senator's office nor the VA could readily identify. In Atlanta, Carolyn Ryan, CBS 46 News.